Welcome back to the channel. If you are working on NHS-FPX6008 Assessment 2 and your goal is to earn a distinguished grade, then this video is for you. Many students lose valuable marks because they misunderstand what this assessment is asking them to do. Instead of simply describing a healthcare problem, Assessment 2 requires you to conduct a needs analysis, which is a systematic evaluation of your organization to determine why a specific healthcare economic issue should be addressed. In this video, I will explain exactly what Capella University's graders are looking for and how you can align your paper with every criterion in the scoring guide. The first thing to remember is that Assessment 2 builds directly on Assessment 1. This means you must continue discussing the same economic issue that you previously selected. Whether your topic is nurse staffing shortages, patient readmissions, medication errors, emergency department overcrowding, or another economic challenge, you should not switch topics. Instead, build upon your previous work by demonstrating why this issue requires organizational change. I will show you how to summarize the issue effectively while explaining its impact on your work environment, your organization, your colleagues, your patients, and the surrounding community. Next, we will discuss how to develop a strong rationale for addressing the issue. One of the key requirements of this assessment is identifying the performance gap that contributes to the economic problem. You will learn how to explain the difference between current performance and desired performance while demonstrating why closing this gap is essential for improving both quality of care and financial outcomes. This section is critical because it shows evaluators that you understand not only the problem itself but also its underlying causes. Another important part of this assessment involves identifying socioeconomic and diversity disparities. Capella expects you to explain whether certain populations experience a greater impact from the issue than others. We will discuss how factors such as income, insurance coverage, race, ethnicity, geographic location, age, disability, or access to care can contribute to health inequities. More importantly, I will explain how to support your discussion using credible evidence such as public health reports, organizational data, government statistics, and peer-reviewed journal articles instead of relying on personal opinions. Evidence-based practice is one of the biggest factors separating a proficient paper from a distinguished paper. Throughout this video, I will explain how to use current scholarly research to justify your recommendations. Rather than summarizing journal articles, you will learn how to synthesize evidence and connect each source directly to your proposed implementation plan. This demonstrates advanced critical thinking and shows that your recommendations are supported by high-quality research. Since NHS-FPX6008 focuses on healthcare economics, your paper should also emphasize the financial implications of the proposed change. I will explain how to discuss predicted economic outcomes, including cost reduction, improved resource utilization, increased operational efficiency, lower turnover costs, reduced adverse events, improved reimbursement, enhanced patient outcomes, and greater organizational sustainability. Understanding how to link quality improvement with financial performance is one of the most important skills you can demonstrate in this assessment. Finally, we will review common mistakes that frequently cost students valuable points. These include failing to follow the scoring guide, using outdated references, providing unsupported opinions instead of scholarly evidence, neglecting APA formatting requirements, and discussing the implementation plan without first establishing the need for change. By avoiding these errors and following the strategies presented in this video, you will be well prepared to submit a well-organized, evidence-based paper that meets the expectations for a distinguished performance. Whether you are completing this assessment for the first time or revising a previous submission, this guide will provide the clarity and confidence you need to succeed. If you find this video helpful, remember to like, subscribe, and turn on notifications for more Capella University assessment walkthroughs, graduate nursing assignment guides, APA-7 formatting tutorials, evidence-based practice tips, and academic writing strategies designed to help you excel throughout your MSN program.